If you're looking for childcare, you know it's hard to find and it's expensive when you do find it, especially for infants and toddlers. A new study by the University of Wisconsin Institute for Research on Poverty, in partnership with the state, found that if more childcare slots could open up, if there were more workers. Let's take a deeper look at Wisconsin's childcare dilemma and why it matters to all of us. Joining us is one of the study's authors, Dr. Hilary Shager. She is the Associate Director at the UW Institute for Research on Poverty. Thanks so much for joining us today.
Thanks so much for having me.
The Institute studies poverty and its impact on the state. Why was it important to look at the state of childcare in Wisconsin? And why should it matter to those of us who may not have a child in childcare?
Thanks so much for asking that question. So again, as you mentioned, the study is done in partnership with the Wisconsin Department of Children and Families, and I'm really grateful for the opportunity to work with them and all the providers who took time to share their experiences. As we know, a really large body of research tells us that high-quality childcare can make a big difference in children and families' lives. Lots of positive outcomes, things like academic and socio-emotional development, educational attainment, employment and earnings, less reliance on public benefits, health outcomes. This is especially true for families and children who may be in vulnerable positions, low-income families. So the Institute for Research on Poverty has a real interest in childcare and why it's important to families and our economy. Importantly also, right, it also allows parents and caregivers to work, to enter the workforce, to reduce absenteeism. And yet, even before the COVID pandemic, we know that it was really hard to deliver and access high quality and affordable childcare in this state. And honestly, the COVID pandemic really exacerbated that. But the good news was there was a lot of federal funding that came to states through childcare stabilization grants. And in Wisconsin, this program was called the Childcare Counts program. And so we've been working with the Department of Children and Families to look at how that funding stream has impacted the childcare field and families in this state. This particular study is really looking at, however, what happens when that funding is reduced. So starting in May 2023, the Childcare Counts funding in Wisconsin was cut by about 50%. And so this study is really starting to look at what has the impact of that been on childcare providers and for families, and specifically around issues around supply and demand. So how many open spots are there in different programs? What are families looking for? What are staffing challenges that providers are having?
And what are some of the key findings from that study? What did childcare providers tell you?
Yeah, so there were a number of, I think, key takeaways from this study. And just to clarify, this is a descriptive study, and we're asking providers to report what they're experiencing. First of all, a lot of providers have what we call unfilled spots. So they suggested that they could serve up to perhaps 33,000 more children if they were able to hire all of the staff that they possibly could under their current licensed capacity, and deal with some of the other challenges that they were having. A couple caveats with that. There was a higher proportion of unfilled spots in what we would call group center providers versus family care providers. Family care providers are smaller, serve 8 children or fewer. And also there were more unfilled spots in the southeastern region, so in Milwaukee, than in some other areas of the state. And when we ask staff, why do you have these unfilled spots? Like, why aren't you able to serve more kids in your current capacity when you have licensing to serve more children? They really, again, focused on these staffing challenges, that they don't have enough qualified staff. That's the most common reason. And both group and family providers talked about, for example, not having enough families who are able to access care. And this is when we kind of dove into that a little bit. it's really a mismatch. Kind of the unfilled spots that are available tend to be more for older children, where the much higher demand is for infant care, for example, or that families aren't able to afford care, or they providers are not able to offer the kinds of schedules that parents are having to work with, or they aren't able to offer things like transportation. So that's one of the findings, and I'm happy to talk more about others as well.
Well, let's talk just a little bit about this whole issue in terms of there being a gap.
Yeah.
What's really driving the reason that daycare providers can't get enough people to work?
Right. And a second finding that's very related is that a lot of providers have wait lists, right? So that seems to be a little contradictory, right? We say, where there are unfilled spots, but there are also wait lists. Just over half of providers said that they have a wait list, and they reported having up to, just checking out, for about 49,000 people on their wait list across the state. And they really talked about, again, not being able to hire staff, not being able to compete to provide competitive wages, benefits. We're talking the latest market survey in Wisconsin. The average salary for our early childhood teacher is, in the 20,000s. So it's very low wages. They can't compete with retail, with fast food, with Quick Trip, to be able to provide that. Also, like I said, there's this, very striking gap between the spots that are available, right? So there are spots open for older children, but not for infant care. Infant care is more expensive to provide. There are lower ratios for, very good reasons for between teachers and students. So that's a real problem as well.
When parents can find infant care that is in such demand, as you mentioned, there is a premium for that. If you take a look at the cost of daycare for an infant for a year, it is actually more than the tuition at UW-Madison. How are our families able to meet that need? For some families, the cost of daycare can be more than the cost of housing. Daycare for infants.
That's correct. And I think, again, the other important piece of that to keep in mind is that's despite the fact that the true cost of providing high quality care for infants is probably, way underestimated in our current system. And we still are paying childcare providers, again, this really low wage. So that really begs the question of, how do we fill this gap, that there has to be some kind of non-tuition revenue source. So that was another striking finding, that with the decline in childcare counts funding since May 2023, that a lot of providers had to raise tuition. So over 52% of providers across the state. So there's this gap in the true cost of being able to provide care, what parents can afford to pay. Another thing we talk about at the Institute for Research on Poverty, child care subsidies, how much those are helping families from low-income families, and how, they may not be meeting the needs for low-income families, but many families are struggling. So there continues to be that gap that, just having tuition revenue drive our childcare system is just not a sustainable way forward.
What are some of the solutions then? How do we take care of this mismatch in the care that's provided, as well as being able to drive down the tuition cost, or are those two related?
Definitely related. I kind of go back to the point that in most countries, early care and education is considered a public good, worthy of very substantive public investment. In the United States, we have a much more patchwork system, right? We do have some public programming like Head Start, like 4K, but a lot of it is private. And, what we're seeing in this study is that, without some kind of non-tuition revenue, providers can't afford to stay in business and to pay teachers a living wage, and families can't afford to pay tuition. So, to me, there needs to be some non-tuition revenue that we're talking about here. That could be on either the supply or demand side, probably both, right? Some direct support for providers that in this study, they talk a lot about the different things that they, are struggling with as far as staffing and being able to provide services, but also to families. And that may be through the Wisconsin Shares Child Subsidy Program or other types of programs. And then, when we have the more investment, it's worth looking at, other kind and testing, kind of other adjustments to other types of policies, that may impact things like zoning, things like, how many kids, can be at what kind of centers and family programs that we're able to provide. So there are a lot of pieces, but it really comes back to that non-tuition driven investment.
Could it be as simple as the state just allowing more families to take part in the subsidized care program it offers now for lower income families? Is doing something that simple, expanding the income limits that folks can have, could that make a difference? I say it's that simple, but of course, it's coming up with the funding for it. But is that potentially a relatively easy solution?
Yeah, first, I think it's really important to say there's no one solution. I think it's really important, again, to look at both the supply and demand side and think about addressing both of those at the same time. I do know there are discussions about expanding Wisconsin care subsidies, and as we know, as tuition prices go up, the buying power of subsidies goes down. So we need to really think about that as we watch the implications of the higher and higher tuition. Also, we know that Wisconsin share subsidies uptake has been going down. So looking at, this study doesn't look at that in particular, but does look at that as something that we would want to look at in the future.
Complex issue, lots of moving parts, but from what your studies pointed out, even within the childcare industry, there are some solutions that can allow us to provide better care for more kids.
That's right.
Thanks so much for joining us. We appreciate it.
Thank you so much for having me. Appreciate it.
We are back in just a minute.